Welcome to Speak Up and Stay Alive Radio with author, speaker, and your host, Pat Rouleau.
Serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit.
The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau. Welcome back to the best time of the week, a time to stop and think about how to stay safe or keep your loved ones safe during every healthcare or hospital encounter. And I'm glad you're here. And today we have lots to talk about and a guest who is the longest living lung cancer patient who did not use conventional chemo or radiation. You want to hear that one? So find your favorite comfy listen to the radio seat, kick up your feet, turn off that darned radiation emitting cell phone and enjoy our time together. Because right now it's time for the healthcare hazard of the week.
Don't stop. Don't stop. Don't stop.
Second opinions. Yes, when it comes to your health, I say, don't stop. Don't stop asking. Don't stop researching. Don't stop thinking. Don't stop believing. Let's talk about the word opinion. You know me, I'm a Latin fan. No, not talking about J-Lo or Ricky Martin. Latin, the language. The word opinion, from Latin opinion, means conjecture, fancy, belief, what one thinks. And from the stem of opinare, the Latin stem, think, judge, suppose. Notice, nowhere does it indicate the word fact. An opinion is not a hard fact. It is a view or judgment formed about something, not necessarily based on fact or knowledge, or the beliefs or views of a large number or majority of people about a particular thing. Many people, when told that they have cancer or another life-threatening illness, feel that they must make a decision right then and begin treatment that very same day. And while this may be true in some cases, taking the time to learn about your disease, getting a second opinion, or perhaps even a third opinion, and weighing your options is a very reasonable approach. And you as the patient have every right to make informed decisions that, heck, ultimately affect your life. But many people fear their doctors and they worry that the doctor might become upset if, when the question comes up about seeking a second opinion. I would think that most doctors would welcome another physician's input. Many people suggest that you ask your doctor to recommend someone to give you a second opinion. Personally, I wouldn't do that. I'd go completely outside of the practice, outside of the hospital system, and to go into this realizing that doctors' opinions may differ. According to the Patient Advocate Foundation, they say a different doctor may come up with a different diagnosis, or at least offer a different opinion as to treatment choices. And not every doctor will have the same opinion with regard to diseases and possible treatments. Factors which may have an effect on a doctor's opinion are the technology available to that doctor, school of thought, where they were trained, individual methods of treatment, and experience in dealing with that particular diagnosis. So it's clear that treatment methods may differ. Some doctors prefer to monitor the situation and use less aggressive procedures before moving to surgical interventions. Some doctors like to use more aggressive treatments from the beginning. But by getting a second opinion, you can expand your options about different treatment methods which may be most suitable for you and your situation. I say being informed is always your best option. Plus, if you hear the same diagnosis or treatment option from 2 or more doctors, you'll feel a bit more confident with your decision. And here's another not so nice idea. Because doctors are human, their decisions may be influenced by business, not just medicine. Now, I'm certainly not saying that a doctor would recommend something to harm you, but it's the law of the instrument, the law of the hammer, that says give a boy a hammer and everything looks like a nail. In other words, a surgeon might be more inclined to suggest surgery versus let's wait and see. Or perhaps when more than one treatment option has a similar rate of success, the doctor may make a recommendation that is better for his or her business and not necessarily better for you. I know about this. This happened to me a few years ago. Do you remember when I told you how I went kayaking a while back and how the stairs on the dock totally sheared off as I was climbing down, causing me to fall and have the stairs land on my foot? Well, I went to the urgent care. They x-rayed and wrapped the foot. A few weeks later, I went to a sports medicine doctor who helped somewhat. And then months later, as it was still hurting when I walked, I went to a foot specialist. This guy walked in, didn't wash his hands, took a look at my foot, mumbled some words I did not understand, I think they were in another language, and announced immediate surgery. He then walked out, no goodbyes, and sent his assistant in to make the arrangements. Oh, I myself said goodbye and never went back. And today I'm walking just fine, no pains, no problems. As I look back, this doctor was all about surgery. He was a surgeon. That was his instrument. And my freshly painted pink toenails were just calling for a nice fine slice. Statistics show that over 1/3 of adults in the United States will never seek a second opinion, and almost 1/10 of newly diagnosed patients rarely or never understand their diagnoses. I'm going to guess it's a bigger number than that. Studies have shown that 30% of patients who sought second opinions for elective surgery found that the two opinions were not in agreement. These studies are one more reason why you need to make sure you are educated properly to make the best decision for your health. So when seeking a second opinion, what should you do? First, check with your insurance provider to determine coverage, especially if the visit is out of your network. Assuming it is medically necessary, most insurance plans will pay for at least part of the cost, while Medicare will pay 80% of the cost. And if the second opinion doesn't agree with the first, Medicare will pay 80% of the cost of a third opinion. Patients that belong to a Medicare HMO are entitled to a second opinion, but some plans require referral from your primary care physician. And like most HMO treatments, you must seek an in-network physician. So there's a lot to know. To learn about second opinions, you can go to Medicare.gov. They also have an 800 number, which is 800-MEDICARE. Also, be sure to check to see that the new specialist accepts your insurance type. Diagnostic tests can be very expensive, not to mention invasive. And if you're talking about x-rays and CAT scans, those subject you to high doses of radiation. And many insurance providers will not pay for them if they were completed for the initial diagnosis. So again, lots of reasons to have copies of the tests that you've already had done so you don't repeat them, both for financial purposes and for health-related purposes. Bring your medical records, including copies of all scans, exams, previous treatments, blood tests, and pathology slides with you to the appointment. Be clear what you're looking for from the second opinion. Do you need confirmation that your current treatment recommendation is correct for you? Or are you looking for other options? Are you interested in clinical trials, alternative modalities? Sometimes there may not be time to get a second opinion. Getting a second opinion may delay treatment that you might need. So if you have a serious medical condition, you should take this into account when deciding to ask for a second opinion. Bottom line, remember, the root of the word, Latin, opinare, which means think, judge, suppose. And notice nowhere does it indicate the word fact. And given that a set of symptoms does not take into account you as a unique individual, an opinion simply cannot be a hard fact. It is a view or a judgment, not necessarily based on the knowledge of you, your mindset, your genetics, your will. And in just a bit, today's guest is going to share his story about how he was given a cancer death sentence, and today can proclaim that he is the longest living lung cancer patient who refused chemotherapy and radiation. Again, not saying that you should do this, but it is your right and option to seek additional opinions. As I said at the beginning, when it comes to your health, I say, don't stop. Don't stop asking. Don't stop researching. Don't stop thinking. And certainly, don't stop believing. And with that, let's hear some legal news you can use. You've heard me talk about my attorney friends at Schraff & King, and I know many of you have taken my advice and contacted them to help you with your advance directives. Things like a healthcare power of attorney, living will, help with information about the Do Not Resuscitate form, and more. Attorneys certified in elder law offer you something that other attorneys do not. So don't go anywhere else. Contact the folks at Schraff & King today. They're located in Willoughby Hills, just south of State Route 6 and Interstate 91. And you can call them at 440-585-1600. That's 440-585-1600. Or visit them online at schraffking.com. SCHRAFFKING. schraffking.com. And be sure to let them know that you heard about them here on Speak Up and Stay Alive. Again, it's 440-585-1600. 440-585-1600. Call them today. After the show, be sure to visit the website, speakupandstayalive.com, for more life-saving information. Plus, that's where you can purchase the book, Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide. Bring the book to the hospital with you. It's the best way to stand out, and in a positive way. And remember, we donate 2 handmade pillowcases to either a troop member or to a local veterans shelter for every book sold, with your name on it as the donor. Give a meaningful and useful gift that really says, I care. Give the gift of healthcare safety. Purchase the book, the patient safety logs, and throw in some of those icebreaker cards. It's a one-size-fits-all present that everybody needs. You can order online at speakupandstayalive.com, or you can request by email at speakupandstayalive.com, or call me 440-725-5462.
Listen to Pat Rulo and Speak Up and Stay Alive RadiOh. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.
You are listening to Speak Up and Stay Alive Patient Safety Radio, and I am your hostess, Pat Rulo, always bringing you guests and topics that go where mainstream stops. And today, we are fortunate to have quite a guest who saved his own life by listening to his intuition. And he has a story to tell. I met him as a fellow radio host, as he also has a wonderfully informative health program that now airs on our internet radio station, Speak Up Talk Radio. He is Dr. Carl O. Helvie, a registered nurse with 2 masters and doctorate in public health and wellness, and 60 years experience as a nurse practitioner, educator, author, and researcher. He has published 8 books, 55 articles, 58 research papers presented around the United States and Europe. Carl chose a holistic approach after being diagnosed with lung cancer and given 6 months to live some 40 years ago, making him the longest living lung cancer survivor who refused chemo. As I mentioned, he has a radio show, and it's called Holistic Health Show, to help others achieve the results similar to his. He is the author of the book, You Can Beat Lung Cancer, Using Alternative Integrative Interventions. Well, he is a wise and kind gentleman, and I'm happy to have this opportunity to share him with you. So welcome to the show, Carl.
Thank you, Pat. I'm happy to be with you.
Oh, gosh, we're happy to have you here. Now, Carl, I want to really dig into your journey a little bit here. Lung cancer, it has very few symptoms before it becomes advanced and difficult to treat. And I know that you have this amazing story to tell. So tell us, did you have any symptoms that caused you to seek medical attention?
No, I didn't, Pat, and I think that was a godsend. And the reason that I went to the doctor initially was because I had a dream that told me to go for a chest x-ray. And I believe in my dreams because I feel that is one way that God speaks with us if we listen. So I pay attention to my dreams, and so I went, and that was the beginning of my journey.
Now, how many times have we, I'm sure all of us and our listeners have this strange feeling, and you're like, no, and just go to work and forget about it. Mm-hmm. There's probably, though, a fine line between listening to those voices in your head. And how did you know that this was really something you had to pay attention to?
I think, Pat, because I've had this before, and after a while you get to the point where you know that it's something that you need to act on. and not nonsense.
Yeah.
And especially if it repeats or if it's in color or what, some of those things are important things to remember. But at the time, I was watching all of my dreams, so I kept a pencil and a pad by my bedside, and I gave myself suggestions before I went to bed that I would remember my dreams. One thing that's important for your listeners to know is that you have to jot down a few words before you put your feet on the floor, because once you put your feet on the floor, the dream is gone. But if you just jot down a few words and then, you get up, the whole dream will come back to you.
Interesting. So there's a whole process in paying attention to not only your dreams, but just some of your gut feelings as well, I'm sure. Now, Carl, when you went to your doctor, did you say, I had a dream?
No, I didn't. My doctor was very conservative, and as I say, 40 years ago, they were less open than some of them are now. So he kept asking me why. Did I have symptoms? I kept saying no. And I finally wore him down, and he finally sent me for the X-ray, and it came back positive. I mean, there was a spot that hadn't been there previously. And so then he asked me to go for a biopsy, which I did. And then they come in and they start telling me they're going to do chemo and they're going to do surgery. And I told them, no. I don't make snap decisions. I go home, I pray about it, I think about it, and I make a rational decision. And your responsibility is to tell me the pros and cons of surgery and chemotherapy, and my responsibility is to make the decision. And they just wouldn't let up. They just kept saying, no, we make the decision. I kept saying, no, you don't. I make the decision. I think doctors were so used to being God that they didn't think that patients could make the decision, but hopefully they're learning.
I'm trying to help our listeners to encourage them to, if they get that kind of a diagnosis or whatever kind of a diagnosis, to stop like you did and take the time and go home and think and pray and research.
Right.
Because that's important. Now, why did you choose then to the whole alternative intervention instead of conventional care? Was it because of your background?
No, I came home and I had a good friend who actually was my physician's sister, but he didn't know I knew her, and she was the opposite of him. She was very progressive, and she said to me, well, do you want me to pray with you and for guidance? And I said, yeah. And so we prayed, and we watched our dreams. And she also asked if I wanted a psychic reading. Well, I'd never had one, but I thought, what do I have to lose?
Right.
And so I had this reading, and we compared our notes, and we compared what the psychic said, and everything came back that I should treat it naturally. I should not do the chemo and the surgery. And so I chose to use the natural approaches. One thing I wanted to say, too, is that when the doctor tells patients that they've got 6 months to live or 3 months to live, I get a lot of emails from people, and they've been given that prognosis. And I tell them that is not a medical diagnosis or it's a God diagnosis, and only God knows when we're going to die, and that they should not pay attention to that they should pay attention to their own intuition, because I think that our mind has such an influence on our body, and if they believe that they will probably die in the 3 months or the 6 months. And more recently, they have found with the epigenetics that our mind can even influence our DNA. So we have to stay positive, and that's one of the very important parts of cancer treatment, is to have faith, stay optimistic, and stay positive. So get over the 3 months or the 6 months,
Yeah.
That gives people hope.
Absolutely. We talk about that a lot on the show, the whole connection between the mind, the body, affirmations, guided imagery. Right here on my desk, I have a little note to myself, you are what you think about. And yeah, you can pretty much create your own reality in many instances. How did your family and your colleagues and friends react to your decision when you said, no chemo, no radiation?
I think you have to be strong to stand up to, a family that has a whole different feeling. But my mother, and I knew she loved me, but my mother's attitude was, well, just do what the doctor wants you to do, and then do these other things. And my colleagues, all nurses, and they all were very oriented to traditional medicine, they either wouldn't talk to me at all about it, or if they did, they'd try to pressure me into going for the chemo and for the surgery. Wow. So Ursula was really the only support that I had that was available, day or night, which was also important, because I think that people, when they have cancer, they need a support system, but they need a support system that is going to support them no matter what their decision is, because it's empowering for a patient to make a decision and to get support for that decision. And an example is my brother was diagnosed with lung cancer last year, and he had a lot of faith in his physician that he'd had for 40 years. And so he wanted to do radiation, which is what his physician wanted. And I knew that that was not going to help. Mm-hmm. But I did not, I felt, well, it's his decision, and he's happy with that decision. The only thing I did was I asked him if he would also add Laetrile, which is what I used. Mm-hmm. And he said, of course I will. He said, you know what you're talking about. So he added the Laetrile, but I think his memory had gotten so bad that I don't know how much he remembered to take it. And they gave him 5 days a week for 5 weeks of radiation, and I thought that was a little much. For a 91-year-old man. Oh. And then he had 2 weeks, and after 2 weeks, he went to get up one night to go to the bathroom, and he couldn't walk. Sure. They put him back in the hospital. They said the tumor had not shrunk. They were going to do chemo. Oh. And his daughter said, I just want him comfortable. If he needs morphine for the pain or whatever he needs, I just want him comfortable. And they put him in hospice, and he died within a week.
Classic sequence, isn't it?
Mm-hmm.
Yep. And first, let me say that I'm sorry about your brother and that you had to go through that. And what you were doing was giving him unconditional support. So I think that's huge.
Right.
Yeah.
Right.
Let's talk for a minute. Laetrile. That's my dad had colon cancer, and we tried. I think it was a mental thing. I think he was ready to let go, but I was, the proponent of the non-conventional side, and we were doing Laetrile. Explain what that is to our listeners.
Laetrile is vitamin B17, or amygdalin is another name, and the major source of it is the apricot kernel, but there's many food sources that have Laetrile, and the theory is that we have a deficiency of vitamin B17, and then we develop the cancer because of the deficiency. Mm-hmm. And there are certain things that are very important that you take with it. A lot of people just take the Laetrile, but by itself it's not really the best, because the cancer cells have a very strong protein around the cells, and it's hard to get the cancer killer into the cells. And so I took pancreatic enzymes, and they soften the shell around the cancer cells so that the Laetrile can enter. I also took zinc, which carries the Laetrile to the site. Mm-hmm. I took high-dose vitamin A to prevent the normal cells from converting to cancer cells. And it's interesting because my doctor told me this 40 years ago, and about 8 months ago, Pat, I saw research, because I read the research every Sunday, I saw research that said they had taken vitamin A, they had put it on cancer cells, breast cancer cells, they had put it on normal cells, and they had put it on precancerous breast cancer cells. It did nothing to the cancer cells, it did nothing to the normal cells, but it reverted the precancer cells back to normal cells. Isn't that interesting?
Wow.
Years later.
Mm-hmm. That's huge.
And so the other thing I want to mention about the Laetrile is that a lot of the traditional literature will say that Laetrile has cyanide in it. It will kill you. It will send you to the emergency. I said ignorance is bliss, because I took it for 2 years. I had no side effects. But what the literature doesn't tell you is that there is cyanide in the Laetrile, but it requires certain enzymes to activate the cyanide, and cancer cells have those enzymes, but normal cells do not. And so it is very specific for the cancer cells and does not affect the normal cells.
Wow, that is interesting. I was just recalling it was 20 some years ago, and I believe my dad was doing the injections of the Laetrile initially. Now, so with the regime that you were following, were there any side effects that you remember?
No, I had no side effects at all. I was teaching at the university at the time, and I went to school every day, and I was writing books and doing research and traveling, and no problem at all. I carried the apricot kernels with me because I took apricot kernels also. I carried those with me, and I ate about 25 of those during the day. They're very bitter, but you get used to it after a while. And, you know, when you have something like cancer, you don't mind.
No.
But the other thing was that the doctor put me, and again, I think this was very progressive, the doctor put me on something that was like a vegan diet, and so I had all the fruit and vegetables I wanted, and 75% was raw, and then I could have some additional cooked. I could have grains and nuts, and that was it. No protein. I took a pre-digested protein, no simple carbohydrates. So it was very much like a vegan diet. And you know, Pat, I think that there is something to the vegan diet because I've gone back on it for my heart, and I'm doing very well, you know, and I think that the vegan has helped. There's a Dr. Esselstyn who has done research, and he has found that his patients that have had heart attacks and all, he puts them on a very strict vegan diet, and they never have another heart attack. They don't have any more major heart problems.
Interesting.
Once they're on the vegan diet.
No, I agree with you 100%. I mean, we are what we eat, and it would behoove us to think ahead of time. So your regime was the supplements and diet. I'm sure there was a lot of mental work that went on.
See, that's the one thing that the doctor didn't do, and they still don't, and that was they focused pretty much on the physical aspect.
Yes.
And I thank my doctor for the physical aspect because he certainly knew what he was doing, but I added the mental, spiritual, because with a public health background, I was taught that there are multiple factors in man, the environment, and the disease agents that lead up to disease processes or wellness. So it seemed that there had to be multiple factors that would resolve the cancer process. And also I had volunteered a few summers at the Edgar Cayce Children's Camp, and I had learned a lot about the Edgar Cayce approach to things, and he was very much into using a holistic approach that was physical, mental, spiritual.
Right, right. Well, so if this has been around so long and people are doing well and improving and staying healthy with these alternative and integrative interventions, why does mainstream media not embrace this?
And you know the answer to that.
I do know the answer to that.
Money, money, money. Greed, greed, greed.
Oh, that was a rhetorical
question. What would happen if there was a cheap cure for cancer? What would happen to the whole medical system?
Absolutely.
I mean, you know, they'd have to go scurrying around finding something else. The drug companies make money. The American Cancer Association stays in business. You know, the doctors make a lot of money on the chemotherapy because they buy it wholesale and they sell it retail and they get paid for administering it. So everyone makes money. They even have an anti-quack law at the federal level.
Yep.
And so if a physician is brave enough, as mine was, to try to be more interested in helping people than in making a lot of money, survival rate for traditional treatment for stage 4 cancer is like 2 to 5%, 5-year survival.
Right.
Well, that's nothing. But if they venture out, like my doctor did, then they pull out the anti-quack law and they put them out of business. And my doctor, he was working for the National Cancer Institute, and he was having so much success that they closed him down, and then he did it in his office. And I had to sign forms I wouldn't report him, but within 5 years, they had taken his medical license.
Oh.
Dr. Forsythe, who wrote a chapter in my book, he was having so much success, and by success, let me tell you, the traditional 5-year survival for stage 4 is 2 to 5%. His 5-year survival, and this was 3 years ago, was 46%.
Ooh.
And so, and I understand now it's around 60%. And so he was such a threat that they went after him, and he told me, he said they couldn't take my license because he is in Nevada, and he's not only an MD, but he's a homeopathic doctor, and the scope of practice is a little bit broader.
Yeah.
But he said what they did was to try to bankrupt him, and he said it cost me a lot of money to defend myself.
Isn't that sickening?
Yes, it is.
It's just unbelievable. But folks can gain some wisdom from your book. You can beat lung cancer using alternative and integrative interventions, and you've got other medical contributors in your book. And where can folks find your book?
It's on Amazon and Barnes & Nobles, and on my website is beatlungcancer.net.
Okay, beatlungcancer.net. I'm writing it down. Beatlungcancer.net. And I hope all of our listeners are writing that down. Beatlungcancer.net, because it's not just lung cancer. I'm sure that's applicable to any type of cancer as well. Well, now in wrapping up, I'm going to ask you, what advice would you give to someone who has been given a diagnosis with little or no hope? We kind of touched on that, but just in wrapping up.
I have found, Pat, that when you have a problem, the solution is always there. It's just a matter of kind of praying and asking for help, and the help will appear.
Yep.
So I think that people shouldn't rush into something, but make their own decisions, because it's their life and it's their journey. You know, I'm glad I went through the experience. I don't look at everything now. I used to look at things about why is this happening to me, but I don't anymore. Because now I feel that had I not had this experience, Pat, I wouldn't be able to share and give encouragement to people that I can do as a result of having had the experience.
So many people say that because you do come out the other end with a lot of valuable wisdom and help for other people. And you mentioned for people to be open and to listen to their intuition, and that the solution's always there. I mean, they say when the student is ready, the master appears. So maybe the master is always there. The student just needs to be ready. So encouraging for folks to look inwards and to stop and think and not take that first devastating answer as their life sentence, really. Now, you said folks can get in touch with you. The beatlungcancer.com is your website. Do you want to share an email address or a phone number?
People usually get in touch with me through email, and my email is Carl with a C, Helvie, Helvie, at cox.net.
Okay. So it's Carl, C-A-R-L, Helvie, Helvie, Carl Helvie at cox.net. And I encourage folks to also go to that website, beatlungcancer.com. And Carl's radio show, Holistic Health Show, is now heard on our very own network. Just go to speakuptalkradio.com, speakuptalkradio.com, and you can listen anytime, 24/7, and I encourage folks to do that. What an awesome testimony to the power of nutrition and natural therapies for long-term healing. And just as important, Carl, what a testimony to trusting your gut, your instincts, and your intuition. And you are just a wonderful, wonderful man. I'm so pleased that we met, and thank you for sharing with us today.
Thank you, Pat. I appreciate the opportunity.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare and hospital safety snippet just for you. Here's our expert, Pat Rulo.
Hey, Jerry. Even though you think you're really cool and invisible, smart hospital patients know that you and your buddies hang out all over the place. What am I talking about? Oh, we know your hiding places. Doctors' lab coats, privacy curtains, the TV remote, bed rails, and even hospital pillows. My friends know not to bring their favorite pillow with them to the hospital and then bring it back home. You'd just love to hitch a ride and get out of the hospital, wouldn't you? Well, If we must bring a pillow, we bring a cheap one and leave it at the hospital as a parting gift. No cross-contamination here. For more hospital safety tips, visit speakupandstayalive.com. So ha ha ha, Jerry, we're not sleeping with the enemy anymore.
Stay safe. Listen to Speak Up and Stay Alive Radio. For more information, go to speakupandstayalive.com.
You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rulo. So happy to spend this hour with you to help you survive any healthcare or hospital encounter. Well, now today, I personally invited a very special gal to join us. Her name is Jerry, and she is a longtime loyal listener in the greater Cleveland area. We need more Jerrys in this world because for the past 6 years, she has been a major caretaker of her mom. So I thought we'd lighten her load a bit and have her join us as we open the game chamber and play one of our most favorite games, Are You in Jeopardy or Are You Safe? So welcome to the show, Jerry.
Well, it's a pleasure to be here. Thank you so much for inviting me.
You are welcome. So here's how the game goes. I will describe a healthcare or hospital-associated scene, and you, our contestants, have to decide how you would react. Are you in jeopardy or are you safe? So today we have 3 contestants.
Now entering the studio are today's contestants.
I'm Bob, and I'm from Gatlinburg, Tennessee, and I'm a former financial planner.
I'm Eric, and I'm a regionally famous radio producer from Northeast Ohio.
And we have Jerry.
Right now, I am in the caretaker role.
Yes, you are.
And very happy to be there because it is an honor and a privilege to take care of my mom. We've always been close and always been best friends.
Oh, you're a sweetheart, and I thank you for that.
These people will compete today on
Are you in jeopardy or are you safe? So you guys ready to go?
Let's go for it.
Here we go.
All right, let's do it. All right, here is the first scenario. You are diagnosed with pre-diabetes. Every night before bed, you eat a bowl of chunky chocolate mocha choca ice cream and a can of Coke. Are you in jeopardy or are you safe?
Well, I'll go first. I definitely think you're in jeopardy. That's just putting more sugar in your body, and that's just not worth it.
I agree.
Nothing
Very
I can
much
add
so.
to that.
That was an obvious one, right?
Yes.
Okay.
That was an easy one.
Well, wanted to start off.
I appreciate that.
That's what I thought. I'd get you in there easy, guys. Prediabetes typically has no distinct signs or symptoms, and it's often described as the gray area between normal blood sugar and diabetic levels. The diagnosis of prediabetes is a risk factor for developing diabetes, so it's not an absolute certainty. So I think it's obvious that if you or a loved one is diagnosed with prediabetes, diet and exercise can normalize your blood sugars and reduce your future risk of developing diabetes. Probably none of us should be eating mocha choca chocolate ice cream and Coke before bed, right?
Boy, and that's the truth.
I guess that makes sense, but
But it tastes so good sometimes.
yes,
Might keep
sometimes
you up, though.
It's tough.
It would keep you up. All right, guys, that was easy. All right, here's scenario number 2. You watch way too many hours of TV and notice hundreds of drug advertisements. Lately, you feel concerned about every ache and pain. Are you in jeopardy or are you safe?
Well, I guess you could be in jeopardy because if you start stressing about that too much, you can either be hypochondriac or, maybe you can just be just too stressed. You can stress yourself out, just worrying that you're going to get everything that you hear about. So I'm thinking jeopardy.
I'd say maybe Jeopardy for the same reasons, but don't assume anything until you actually go to a doctor and get yourself checked out.
I think that's
That's
pretty
a good one,
advice.
Eric.
Yeah.
You know what I do on that? I put it on mute because I don't want to hear any drug ads. I don't take any and I don't want any.
I think you are
Well-
all right. These direct-to-consumer drug ads are dangerous to your health. We have golfers touting this and actors pushing that, and they have very limited educational value and basically are sensationalism, kind of marketing ploys designed to push a product, or should I say an industry. So I'd say be mindful when watching these, or as Bob said, press the mute button or stop watching so much TV.
That's true.
Yep.
Well, I like to watch my news,
Well, you can watch the news, but
but it's loaded with drug ads lately.
did you know that United States and New Zealand are the only two countries that allow direct-to-consumer advertising like that.
Wow.
Isn't that crazy?
Yeah, well,
Yeah.
I think they ought to outlaw it, but that's the way they make their money. Let's face facts, follow the dollars.
All right, we got a handle on that. All right, here's scenario number 3. You are being prepped for surgery. Your nurse enters the room with a razor to shave the area around the upcoming surgical site. Are you in jeopardy or are you safe?
My first impulse is to say safe, because it's good not to have hair in the way there.
Yeah, you're thinking this is a trick question,
Yeah.
right?
Yeah, I don't know. I just have that paranoia for some
Oh,
reason.
okay, all right.
I guess it depends on if what she's shaving with is sterile, and if she has before shaving, I would think you would have to put some type of antiseptic or something on the skin first.
Good answer. That's
what I'm thinking.
I just want to make sure she's shaving the right place where I'm having surgery.
Oh gosh, hadn't thought of that.
Oh,
Yeah.
that's the truth.
Yeah,
We've
sometimes
heard, those horror stories.
The answer I was kind of looking for was that shaving can cause small nicks in the skin, actually, which can contribute to surgical site infections. So what I would suggest is, I agree with you, Eric. Yeah, you don't want hair in the location. So you would ask maybe if that was, first of all, really necessary, or if they could simply clip the hair or use a depilatory instead of actually doing the shaving. You might also ask if you could be taking a pre-surgery antibiotic about an hour prior to surgery. That's another measure that could be used to prevent infections.
you just taught me something. That's good.
Yeah, those are.
Wouldn't have thought of a depilatory.
Yeah. So always ask. I mean, I think, Eric, you're absolutely right that hair needs to be removed, but are there other ways we can do it? All right, something to think about, people. Hopefully we don't have to think about that. Here's scenario number 4. You go to your doctor for a checkup. Your usual normal blood pressure reading is a bit high. Your doctor suggests that perhaps you are a bit nervous and takes several additional readings throughout the appointment and mentions maybe you have white coat syndrome. Further readings show a normal blood pressure reading. Is what he did, does that keep you in jeopardy, or would you be safe?
No, you'd be safe, I would say, because the white coat syndrome, that's relatively common amongst people, I think. And I sometimes when they first walk into a doctor's office, they're just really nervous. For a doctor to wait a while, maybe joke with the patient, talk to them, get them a little at ease, and then take it again, I think you have a better chance of getting a more normal reading as time goes on. So I think that's a great idea.
I think Jerry needs my job here.
Jerry, you're getting to be an expert on this.
I've had a lot of practice.
What do you think, Eric?
Yeah, nothing to add.
Okay. What do you think, Bobby?
I think you're safe. I really do. Because, like Jerry said, the white coat syndrome, it affects a lot of people.
Right. I'd say you are fairly safe in that your doctor actually was quite caring and concerned enough to mention that some folks do have slightly higher blood pressure readings when they see the scary white lab coat. And so if that does happen to you, for all of our listeners, request several readings during the appointment, maybe get a nicer looking nurse to come in or something, and maybe even monitor your readings throughout the next week. Go to your local pharmacy and have several blood pressure readings taken. So don't run for the statin drugs right away. You might just be having white coat syndrome, right?
You got it.
It's a conditioned response, like Pavlov's dog.
Absolutely.
Yeah.
Except we're not salivating, right?
No, right. It's right. It's kind of, yes, it's different in that way for sure.
That would be a horrible mess.
That would be, yes.
He would need his white coat then.
Definitely.
All right, you guys. Here's our last scenario. You guys are good. You are a caretaker for an elderly parent. Occasionally, you take the time to leave the house and do fun things on your own. Visit with friends, catch a movie, or even get your hair cut or go shopping alone. You realize that you'll be no good to your loved one if you are not in tip-top shape. By doing these things for yourself, are you in jeopardy or are you safe?
It depends on the person that you're taking care of, if they are able to safely stay alone until you do these things, or if you are able to find maybe someone that you really trust. Trust is important,
Yes.
To be with that person. But and the other thing too is sometimes the person you're caring for suffers from like separation anxiety, and you not being there makes them worse. So there's a lot of different ways to look at this one.
Absolutely. I agree with you.
Yeah, I mean, You would be safe, but would the person you're a caregiver for be safe? That's the concern.
Excellent question. What do you think, Bobby?
I think that's very true. I think you just about have to have all your ducks in a row before you take off, because you got a lot of stress on you when you leave, because you're going to be worried and you want to make sure that person's taken care of. So it's a two-edged sword there both ways.
Exactly.
Yeah, there's a lot of guilt that goes along with being a caretaker. I mean, it is a safe and a sane thing to do if you can, because as a caretaker, you are a very important person. So it's important to take care of yourself and take the time to look after yourself too. And it is okay to be concerned about yourself.
And if you can do some of those things for yourself, when you come back to being the caregiver again, you're kind of fresher. You've been refreshed, and you can approach it with a little bit more, I don't know, you're not as, you just kind of feel better, like you can take it on again, But again, every situation's so different too, though. So it's hard.
It is hard, and you've been doing a great job. Well,
thank you.
I do mean that. Well, I thank all of you guys. We had a lot of good information today, and I thank you for your excellent input. Bobby, I thank you.
You're welcome.
Eric, thank you.
You're welcome.
And Jerry, thank you so much for being here.
God bless all of you. You're all so sweet. This was such a nice experience, and I just feel so honored that you called me and asked me to do this with you, Pat.
Well, I feel honored and blessed that you listen to our radio show every week, and you have so many great comments and things to say about it. So we need more listeners like you to care about what it is that is going on in healthcare safety.
Oh, that's so sweet.
Well,
thank you so very much. God bless all of you, the work you all do.
Well, thank you. I'm not sure who won that, but we're all winners.
We're all winners.
We are all winners because we know a little bit more about patient safety. And so thank you, everyone, for playing our newest and our most fun favorite game ever. Are you in Jeopardy or are you safe? And listeners, don't go anywhere. There's so much more you can learn about healthcare and hospital safety on America's favorite and perhaps only patient safety radio show, Speak Up and Stay Alive Radio. Yay, you did good.
Yay. That was good.
Thank you, Jerry. You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am Pat Rulo, your hostess and author of the book Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide, available at all of our live speaking events or at our website, speakupandstayalive.com. That's where you can also locate radio show times, dates, and station information. That's speakupandstayalive.com. If you know me, you know that I'm concerned about healthcare-acquired infections. Stethoscopes have long been associated with the transmission of healthcare-related bacterial infections, and studies have shown that stethoscopes carry harmful bacteria such as staph. To eliminate the infection risk, doctors simply need to wipe their stethoscopes with a disinfectant swab after use on each patient. Despite this, a report in the American Journal of Infection Control makes it clear that providers do not heed the warnings, concluding that doctors must routinely disinfect their stethoscopes before and after each patient contact. There is, however, a viable alternative to the disinfectant cloth or wipe. Clean Stethoscope, offered through a company called Cleanant, is a device that enables doctors, nurses, or any healthcare practitioner to both protect and clean their stethoscope with the greatest of ease. By sliding the bell of the stethoscope into the Clean Stethoscope chamber, doctors can examine multiple patients without putting themselves or their patients at risk of healthcare-acquired infections. If you're a healthcare provider or if you're a patient, check out Cleanant.com. Cleanint, Cleanant.com. And patients or family members, tell your doctor about Cleanant and ask that their practice include the Clean Stethoscope from Cleanant. Call 888-715-0464. That's 888-715-0464. Wow, another fun and fast show today, and I hope you got some long-lasting takeaway when it comes to seeking a second opinion. Let me know what you think about second opinions. Have you ever asked for a second opinion? What was the reaction? What was the outcome? Share your thoughts on the air. Just call and leave your name and number, and we will call you back on Saturday between 2 and 3 p.m. Eastern Time. We'll be in the studio again then to pre-record your thoughts. You don't have to include your name. We just want to hear what you've experienced when it comes to second opinions. Call me at 440 440-725-5462. 440-725-5462. Or you can email Pat at speakupandstayalive.com. Pat at speakupandstayalive.com. And again, I will personally call you back between 2 and 3 p.m. on Saturday Eastern Time. Call or email soon because we can only get back to a few folks each week. And after today's show, head over to our internet radio station for more outstanding health-related and other inspiring programs. Go to speakuptalkradio.com. That's speakuptalkradio.com. That's where you'll find shows such as Animal Talk Naturally, Boil the Frog Slowly, Entrepreneur on Fire, Health Talk with Dr. Len, Helping Writers Become Authors, Love Life, Mrs. Green's World, Psychics Gone Wild, Realty Universal Radio, The Taz and Paula Show, The Gift of Choice, The Holistic Health Show, The Janet Love Show, The Jen Royster Show, The Vaccine Agenda, Those Weekend Golf Guys, and so much more. Wow, you'll be listening all day. So visit speakuptalkradio.com. Leave it on while you work, relax, cook, or eat. Empowering programs just for you from me. And then be sure to come back to this station next week. Same time, same place, but never the same information. In fact, I've got a numerologist as a guest who's going to read my numbers, and that should be interesting. Until then, I hope you have a healthy and a happy week, free from second opinions and boys with hammers. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
Listen to Pat Rouleau and Speak Up and Stay Alive Radio. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.